So here we are at the Leptong Medical Center in northern Uganda, and it is a beautiful facility that we're going to be taking a look at in a few minutes. But Dr. Robert Odero is the Chief Medical Officer here, and he's also the Regional Medical Authority for this entire area. And then Dr. Andrew Achan, who is an internist and does some work here, but in other parts of Uganda as well. And we're going to talk about waterborne diseases. Now, first of all, Dr. Robert, what percentage, if you will, of waterborne diseases in terms of the overall hospitalization of patients do you see here?
Actually, it accounts to around 23% of all the infections in the entire district.
23%?
Yes.
And is there a common theme, like is there one or two waterborne diseases that's more commonly seen than others?
Yes, it's commonly seen, actually more in children than in adults.
And so what would it be, diarrhea mainly?
Yeah, diarrhea, abdominal cramps, vomiting. Those are the major presentations.
I've read in research we've done for this time in northern Uganda, Dr. Robert, that more children die of waterborne diseases, especially of diarrhea and of HIV and malaria and almost everything else combined. Is that true?
That's true, but the commonest killer disease here is malaria. That is the number one killer.
Victory Outreach has been focusing very strong, and we've been helping them with this, on sanitation, on pit latrines, and placing them in such a manner that they're not going to compromise the water table. Does that have its impact in the long term in terms of public health?
An evaluation was done recently. There was almost a 90% decrease in the hospital admissions from areas where you had better sanitation, hygiene education, and also water.
This is what I would call it HIV-associated diarrhea. She's positive. She has already been started on ARVs.
And what is your expectation? Is she going to improve, or are you concerned that she may not?
Most probably she's going to be okay.
Well, that's great.
Provided she adheres to her treatment.
Right.
Now we're having the elephantiasis.
So this is something that Canadians would never see. What is this, and what makes it happen?
This is caused by filariasis as well. As a result of the blockage of the lymphatic system, you find that the backflow of the lymphatic system is blocked, and you get accumulation there. The patient step on water and get the infection from there.
And can it be cured?
Yeah, at an early stage. At
the early stage?
Yeah.
And when it's at this stage, nothing can be done?
Nothing can be done.
Is it painful?
Yeah, of course.
Yeah.